Thank you, team, for rescuing me while we are absent here of Anisi, as he deserves a day off like everyone else. And we will pick up the shoes. Okay, so translation is activated. Good morning, everyone. Good morning. Hopefully, everyone had a very restful weekend. It is a little chilly out there, but as we move on through the season, we're going to hopefully warm your hearts with more information that's pertinent to everything providers need to know. Today, we have special guests from the Office of Early Childhood as well as Department of Health. I'm going to kick it off with Deb Fliss from OEC so she could introduce folks, and hopefully we'll have some vibrant discussions on OEC updates as well as Department of Health, giving us a how to, stay nice and healthy this chilly season that's coming up. Deb Fliss, the floor is yours.
Thank you, Ava. Good morning, everyone. Izzy's shoes are big to fill, and Ava, you're doing a great job smoothing out all the newness that we're all taking on. Well, Izzy is not here, so I'm here today to just do a little bit of an introduction and context setting around changes in information in Memo 50 that was reissued for providers after several months of having had Memo 50 out. Memo 50 we thought would be our last COVID memo. Here we are doing one more revision to do a little bit of updating around the most current guidance for COVID, other respiratory illnesses. I'm going to post the memo links in the chat for everyone in a moment. Know that the revision to the memo, which was distributed to providers on October 11th, has a few changes. They are generally minimal but important for providers to be aware of. Those changes include that we removed the link to the outdated weekly COVID reporting form, and that process is no longer. We updated the link to the DPH reportable disease form. We added information on the ability to access COVID-19 tests from the federal government. And we added information about the new OEC health and safety section on our website. So those are the pieces that are new updates in the COVID 50 memo. I also want to call people's attention to the fact that the memo is one page long, but following the memo on pages 2 and 3 are FAQs from the Department of Public Health. And so I'm now going to turn over to the Department of Public Health and welcome Dr. Sosa and Kristen Sota back to the Monday morning call. They haven't been here in a while. They're going to provide some updates and information to further emphasize the information about healthy practices as they relate to respiratory illnesses. So I'll turn over to them.
Great. Thanks, Deb. So thanks for having us back. We wanted to just give an update about where we are at with COVID, RSV, and flu. And I'm going to let Kristen Soto, who oversees all of our surveillance for those three diseases, to give the update, and then we can answer any questions that people have.
Thanks, Lynn, and thank you to OEC for inviting us to participate on this call. I'm just going to share my screen. Can everybody see the PowerPoint on my screen now?
We can see it. You're all
Great.
set.
Perfect. So for today, I'm going to be discussing the management of respiratory viral diseases in childcare settings, bearing in mind that these are really recommendations for the 2023-24 season. And we anticipate that these will be sort of the new normal of recommendations going forward, where we talk about respiratory viral diseases as a whole, as opposed to having very different guidance for all of the diseases. And specifically, we'll be providing a little bit more information on COVID-19, influenza, and respiratory syncytial virus, or RSV. So this graph is showing hospitalization data for a subset of Connecticut hospitals from the last respiratory viral disease season. And you can see that the black line shows sort of the combined burden of the 3 diseases that we do surveillance for. Red is COVID, blue is flu, and green is RSV, or respiratory syncytial virus. So from really October through February of last year, we saw a lot of respiratory viral disease activity. First RSV, then flu, then COVID, with these peaks one after the other. We're not entirely sure what will happen this year, but we do expect to see activity for all 3 of these diseases again for the coming year, which we know can impact both the children that you're taking care of in your childcare settings, as well as the staff and other individuals that you work with. Looking at the far right side of the graph, that gets us to where we are now, heading into August, September, and now October of 2023. And you can see that the green and blue lines, so both flu and RSV, have been relatively flat so far in terms of the number of hospitalizations that we've been seeing. We had seen a pretty steady increase in the number of COVID hospitalizations since our all-time low during July of this past summer. But the good news is that these hospitalizations have currently plateaued. So they're staying pretty steady and not increasing at the same rate. That being said, we know that we are early in the season and that typically we see most of our disease activity in the late fall and winter months. So we're really in a time where we're preparing for the most illnesses and hospitalizations that we expect to see from these 3 diseases and respiratory viral illnesses overall. So last year, you may remember, we had a standalone COVID-19 report, and then we also had a new dashboard for influenza. This year, we've released a new dashboard, which includes information for all of our respiratory viral diseases in one place. This includes information about respiratory viral disease activity overall, disease-specific information for influenza, RSV, and COVID, as well as information about what's going on in our nursing homes and what the state of vaccination is in the state. So how many doses of COVID-19 vaccine have been administered and what the trends with that are. All of this information is available on our website. And after walking through the prepared slide deck, I am going to show you our website and how you can easily navigate to this page to see the information that's there, which is really the best source of local information about what's going on with these diseases as we move through the 2023 and 24 respiratory viral disease season here in Connecticut. In addition to our internal respiratory viral disease dashboard, which is the top hyperlink on this page, we've created a new respiratory viral disease surveillance webpage, which really tries to put all of the different resources from across the web in one place so they're easy for people to find. So this webpage includes the data from past seasons when COVID-19 and influenza were documented as separate reports. It also includes data from the CDC, where our Connecticut data is posted on their federal web pages, showing state level data both for us as well as for neighboring states. And then we've also included some information about different communication tools which are available, which I will also touch upon briefly. So for the current season, we are in pretty good shape with vaccines in that there are now vaccines available for all 3 of the major diseases that contribute to winter respiratory viral illnesses, with those being influenza, COVID-19, and RSV. For influenza, the seasonal vaccines for the current season are now available, and everyone 6 months and older is encouraged to get their shot. The saying that we like to say is flu before boo, meaning that ideally people should get a flu shot before Halloween. And so this is really a great time to encourage your staff as well as children in your facilities to get up to date with their influenza vaccine. And in addition to the recommendation to get influenza vaccine at this time before activity in the disease really takes off to offer the best protection, this does continue to be a requirement for attendance in both early childhood and pre-K settings. For COVID-19, a new COVID-19 booster vaccine is available. This vaccine can actually be used as the primary series for people who have not yet been vaccinated, or as a booster for those who have already received a dose during previous seasons. And everyone 6 months and older is again encouraged to get vaccinated. And then something that's brand new for this year is the availability of vaccinations for RSV, or respiratory syncytial virus. A new vaccine is now available for adults 60 and older, as well as pregnant women. And there is also a new monoclonal antibody treatment, which is available for children less than 2, who are at the highest risk of complications from RSV. So that's really exciting news about ways that people can protect themselves during this upcoming season. During the 2023 and 24 school year, the Department of Public Health will no longer be supplying COVID-19 home test kits. These home test kits are widely available for purchase on the commercial market and available in medical settings for those who do require testing. Additionally, the US government has reinstated their program of shipping test kits through the mail. So each household is able to request up to 4 test kits per household so that they can have them on hand. And for this season, we're really encouraging the use of diagnostic testing in people who would benefit from antiviral treatment. So for individuals who are at higher risk of complications from either influenza or COVID-19, there are antiviral treatments that are available. So we would especially encourage those individuals that could benefit from treatment to get tested and follow up with their medical provider to help prevent some of the severe outcomes or complications from these diseases. As we had stated at the end of the public health emergency and moving forward into the current year, we're really encouraging each childcare provider to develop their own policies to manage respiratory illness in their facilities. And really the focus of these policies should be on how to operationalize the current CDC recommendations based on their specific childcare setting. You all have the best knowledge of how your facilities operate, whether it's sort of a single room with children of multiple ages, a large center with multiple rooms with children of different ages being separated, the number of staff that you have to work with, the underlying risk factor of the children that you work with. And so we've made all of the CDC guidance and recommendations available to you, but understand that you best know how to put those to use in your facilities, both to keep the children and staff that you're working with safe, as well as to sort of keep your doors open during this respiratory viral disease season when we know that these illnesses will be circulating. Some news that I'm sure you're all really excited about is that we are no longer collecting data using the child care reporting form for COVID-19, which was previously submitted on a weekly basis. Additionally, child care providers are no longer required to report individual cases of COVID-19 that occur in staff or students within their facility. I know we've been getting a lot of calls into the Department of Health with people wanting to fill out our PD23 form or call in individual cases, and that is no longer a requirement. However, outbreaks of any kind, including COVID-19, continue to be reportable as a Category 1 condition, meaning that they are immediately reportable by telephone to both the Department of Public Health as well as your local health department. Oftentimes we do get asked, well, what exactly is an outbreak? Is there a set number we should be calling about? We don't want to call too often, but we also don't want to miss reporting things that are important. And so we really have no set definition for what an outbreak is. It's anything that's really above the expected baseline for your facility. So sometimes people choose to use a number such as 3 or more cases in an individual room, or more than 10% of your population is impacted by an illness. But really, we would like to encourage you that anytime you feel that things are unusual or that you need guidance from either DPH or your local health department, that you reach out so that we can discuss the situation with you and make sure that the right steps are being put into place to make sure that the illness is being controlled and that you're able to operate as normally as possible. So one of the things that's a little bit different for COVID as compared to other illnesses is that there is a different isolation policy, meaning that there are different rules or recommendations about when people should stay home if they're infected with COVID-19. So the bottom line is that with any illness, ill students and staff should stay home when they are sick. Keeping people home when they are sick is one of the most important ways to stop the spread of some of these illnesses in all sorts of different settings, including childcare settings. For COVID-19, the CDC currently recommends isolation, meaning staying home for 5 days, followed by 5 days of masking, once an individual is diagnosed with COVID-19, so long as the person is either fever-free for 24 hours without using fever-reducing meds, and their other symptoms have started to improve. For individuals who have been exposed to somebody with COVID, they're still able to attend childcare and work so long as they are not sick. For other viral respiratory diseases, the recommendations are that a person should stay home if they are fever-free for 24 hours without the use of fever-reducing meds, and they're feeling well enough to attend the childcare setting. Oftentimes we get asked about cleaning and disinfection and if anything special needs to be done. There really isn't any type of special cleaning or disinfection that's required. The standard cleaning and disinfection protocols that you're always following are sufficient to kill these organisms if they're on any surfaces in your classroom. Especially RSV can be spread by people sort of touching infected surfaces and then putting their hands in their mouth, especially in younger children. So again, we've posted a link to the CDC webpage that highlights what these basic cleaning and disinfection protocols are, but there's no need to do anything different or hire special crews if you're aware of COVID-19 or other illnesses in your classroom setting. And then when we talk about our respiratory viral diseases, we're really focusing on prevention and helping to stop people from getting sick in the first place. And there are a few basic steps that people can take. We've talked about many of them already, but those include getting vaccinated for flu, COVID-19, and RSV as appropriate, staying home when sick, making sure that people are washing their hands and using good respiratory etiquette, so covering their cough, things of that nature. For individuals that are capable of wearing a mask if they're coughing or mildly ill to help prevent the spread of illness, and then seeking care and getting tested if people are sick for long periods of time or if they would benefit from early antiviral treatment for either influenza or COVID-19. Those were all of the prepared slides that I have, but I just wanted to quickly jump over to our webpage. So this is our main DPH webpage. At the top of our homepage, there is a link that says most popular, and the top link under that is respiratory viral disease surveillance. If you click on that, it will bring you to our new respiratory viral disease surveillance webpage. As I previously mentioned, this includes a link to both the data for the current season, data from previous seasons for both COVID and COVID and influenza, and then respiratory viral disease information from the CDC, from the various surveillance projects that they do, information about COVID recommendations by county, as well as a link to those communication tools that I showed you about basic prevention messages, which are available for use to print as posters or on social media, both in English and in Spanish. If you click on this top link, it will bring you to our dashboard. Luckily, we're early in the season, so there isn't a ton of data here to show you yet. But you can navigate this dashboard by clicking on the different tabs on the left. So for example, to see influenza data, you would click on influenza. If there were multiple sources of information, these would be shown in different tabs across the top. For each screen, there will be data tabs as well as information tabs that provide a little bit of additional information about the data that are currently being reported. And you can see, for example, this is showing the number of influenza tests we've had reported so far this year. Again, a good indication that we haven't really started to see influenza taking off yet this year. We haven't yet seen our peak, which we're expecting probably later in the fall or early winter months. Similarly, for COVID-19, we can see that the number of cases we're seeing so far are relatively stable. And also looking at hospitalizations, we can see that trend of increases since the beginning of the year and a little bit of decrease or plateau over the past couple of weeks. So again, we're seeing more COVID than we were seeing this summer, but haven't really seen a surge like we've seen in past years. Looking at our syndromic data, which is a source of how many people are showing up in the emergency department with different diagnoses, we can again see this similar trend with COVID activity, not a lot with flu or with RSV. Looking at our nursing homes for both residents and staff, we've seen a relatively stable number of both cases and deaths amongst those individuals. And then looking at vaccination, you can really see sort of the increasing uptake of the new COVID-19 vaccine week over week since it was released earlier in September. And you can also see the age breakdown of who has been receiving these vaccines. And what might be of interest to this group is that uptake amongst the youngest individuals, the 0 to 9-year-olds, is definitely one of the lowest age groups. So this is a population where it would definitely be helpful to encourage vaccination as we move into this season to help prevent additional illness. Those were all of the prepared remarks that I had for today, but we will be available for questions if anybody has any questions or comments on what we've shown.
We've got questions. To kick us off, I guess my first question is, do you have all this material translated in Spanish for those who are Spanish speakers?
So I know that the communication materials are translated into Spanish. So the one that showed like get vaccinated, wash your hands. I don't believe, Lynn, correct me if I'm wrong, that our website automatically translates into Spanish. So our other disease-specific information and dashboards, I don't believe are available in Spanish at this time.
So we're making a formal request that hopefully moving forward you could make things available in English and in Spanish in both languages. In regards to questions here in the Q&A, let me just go in. There's some curiosity about masking, and you talked about regulations and what's required and not required. There's not as much access as there used to be for COVID tests. There's people who are providers here on the call who are concerned about tests not being readily available to families. I know Meryl put in the Gov website here. Are there any other locations where they can get tests and free access?
So some local health departments may have test kits that are still available. So I would recommend reaching out to your local health department as they maybe either have test kits that they're able to distribute or be aware of other local resources that they could connect people to.
Awesome.
And I think the second part of that is that we know that not everybody is testing now the same way that they historically have. And there are some people who may have COVID that choose not to test. And if you don't know that they have COVID, it can be difficult to make recommendations about how to manage that illness. And if they should stay home for 5 days or if they should be staying home for just the 24 hours. So that's why we're really encouraging people to make sure that if an individual can benefit from treatment, if they seem really sick and they're not improving, that those are the individuals that we really want to encourage to test to make sure that they're connected to medical care. Testing to help inform public health recommendations about when people should stay home is also another use for these kits, but we understand that that can't happen in the same way that it historically has. And so we're really encouraging people to do their best, but knowing that not every person with COVID will go to a doctor or take a home test, and that we need to sort of have these recommendations in place of how to manage people based on sort of this new normal about what people are willing to do in terms of testing, as well as their access to these kits.
Awesome.
So there was a question about test kits with expiration dates. Is there a good source of information about which test dates have been extended before people throw away a bunch of tests that might still be good?
Yes, so the FDA, or the Federal Food and Drug Administration, is the federal licensing agency that's responsible for these test kits. And they have officially been issuing guidance about what test kits have extended expiration dates. And some of them are really quite far beyond what the original dates tested on the box are. So before discarding any kits, I would encourage people to go to that webpage to see if their test kits are really expired. And we can drop that link in the chat for you.
Great.
Awesome. We have another question here. Just a curiosity, it seems from Anonymous. Why is masking recommended for COVID but not for any other illness?
So this year, we're really recommending COVID for all respiratory viral diseases, not just for COVID.
You mean masking?
You mean masking?
Sorry, what did I say?
You misspoke. Yeah,
COVID.
You recommended COVID for other
Yes,
respiratory.
I would not recommend
Masking.
COVID for other respiratory diseases.
We understood you, but for the
Yes.
purpose of clarity of masking,
Yes.
go ahead, Kristen.
So we would definitely recommend masking for any type of respiratory illness. It can be effective of both protecting you from droplets that other people might be sneezing or coughing around you, as well as, if you have mild illness, prevent your droplets from infecting others. So we talk about it a lot in COVID because that's really when masks first came on the scene in the US. That's really when people first started wearing masks, became used to the idea. It was directly tied to those COVID recommendations historically. But really, they are effective for any type of respiratory viral illness, especially COVID flu or RSV. And so we would encourage people to also use those for those other conditions as well, and not think of them just as a tool that's effective for COVID.
Okay, there's also a question here. Should you wear a mask if you had exposure but no symptoms? And then there's also a question here. Should you wear a mask or should you get vaccinated if you have a cold?
So if you've had an exposure, wearing a mask is a way that you can protect those around you. People may either be asymptomatic, meaning that they don't show any symptoms, or they could shed COVID before they show symptoms. So if people wear a mask, that could be a way to protect those around them if they've had a known exposure. We do know that in the childcare settings, especially, this can be a challenging recommendation since many of the children that you may be working with are too young to effectively wear a mask. And for children less than 2, it is not recommended that they wear masks. And then in terms of vaccination, you were asking if people have a cold, if they should get vaccinated?
The question is, if you have a cold at the time of vaccination, can you still get vaccinated?
Yeah, I would definitely recommend following up with your medical provider. Typically, they encourage people to not get vaccinated if they have a moderate or severe illness, because obviously you need your immune system to be fighting off whatever you have, and will probably have a better immune response to the vaccine. But people can often still get vaccinated if they're experiencing mild symptoms. But again, I would recommend following up with your medical provider to see if they would recommend proceeding with vaccination or deferring it until they're feeling better.
Okay, I'm just putting that in. You said, so Anonymous asked, you said to encourage vaccine among amongst our population to reduce disease, but I thought the vaccine just reduces severity. Does the vaccine prevent infection?
So really the best way that the vaccine works is to prevent severe outcomes. So it can help to prevent hospitalizations and deaths. There is some evidence that the vaccine might help to prevent infections, especially immediately after vaccine. But again, we're really focused primarily on preventing those more severe outcomes. So it can have some benefit for preventing illness. But even if somebody gets the vaccine, they may still develop mild illness. But again, as the person posing the question pointed out, really the main purpose of vaccine is to prevent those more severe outcomes, especially hospitalization and death.
Okay, thank you. Kathy wants to know, will there be updates available to schools and daycares through the Department of Health? I guess regularly or more information?
So we're not anticipating changing any of our recommendations in the near future. We follow the recommendations that CDC posts, and to the best of our knowledge, they haven't given us a heads up that any major changes are anticipated in the near future. So I don't think they'll be providing routine updates like we did in past years where we might follow up every week or every month, but we will definitely keep people updated if there are any changes in recommendation or in response to frequently asked questions that we're receiving.
And I
And
guess, oh,
and
go ahead.
Eva, sorry, schools did get the same update that we're giving to childcare providers now. So they got that a couple weeks ago.
Thank you, Dr. Sosa. That's helpful. Here at Early Care Connection, if there's any significant change or any memo that DPH or OEC lets us know, we'll have them back on. So that's another form of updating everyone in this community to keep people posted. A question I had, when it comes to the regulation changes for providers, this is more an OEC question. At what point, do you coordinate those requests? So I know many of the providers during peak COVID had to wear masks, and there were requirements on, testing and masking. If things become more severe with any kind of respiratory illness, at what point does DPH and OEC decide to make those kind of changes?
So currently everything that we're doing is based off of recommendations, which means that there isn't any type of legal requirement tied to that. I think when we use the word recommendation, a lot of times people think of like, this is something that would be nice to do. Like, can you recommend a restaurant? Yes, I love this restaurant. You should go there. But when we talk about public health recommendations, those are really the best practices that people should follow based on the evidence that is available. So they're a little bit stronger than the words that we normally use. And so currently the recommendations that we have are really tied to what action should be taken based on what we're currently seeing and the current data that are available. At this time, there's no intention to introduce any mandates or really change that, but we are actively continuing to monitor surveillance data. And so if the recommendations were to change, we would definitely share that information with people. And if there was a really significant change in the course of disease in terms of severity or a new pandemic or something of that nature, we would again evaluate the information that's available and take the best course of action there. But we're anticipating that these recommendations will probably be with us for a while based on the current surveillance data that are available and the current projections of what we might expect over the coming year and upcoming seasons.
Awesome, very helpful. Got a question here from Lizbeth. Lizbeth wants to know if a person tests positive and a day or two later tests negative and are fever free, can they return to the center? Can they return back to work?
So on the CDC webpage, there are specific recommendations about how long people should stay out, which is the 5-day recommendation. There is a test-based strategy, which would allow people to, I believe, test a little bit later in their course of illness and perhaps reduce the time that they would need to mask following an illness and the recommendation for that. So really there isn't anything in the guidance currently that talks about people having a test on day 3 or 4 as a way to reduce their isolation window. So again, following the CDC recommendations, we would continue to recommend that that individual isolate for the 5 days following their onset of symptoms.
Okay, thank you. Linda here wants to know that the Connecticut Department of Health, or she wants to point out that New York sent out this completely different topic. I'm gonna ask it because we don't have any more COVID related questions. So just a heads up to our viewers here, this is not a COVID related or vaccination question. So Linda wants to point out that the New York State Department sent EpiPens to childcare centers, and they do it every year. She wants to know if here in Connecticut, the Department of Health would also be sending EpiPens. Is that a possibility?
I don't think that is something we can answer. Sorry.
It's out of left field. Yeah, I guess Linda, you asked. We don't have an answer. This is probably an advocacy question.
I think Deb might.
Yeah, go ahead, Deb.
I want to weigh in here and just say that we are aware and we are investigating around this. There are some legal items that we need to investigate and understand more about in order to understand the full scenario, but we're aware and taking note of it.
Awesome. Okay, those are all the questions that we had for right now. Meryl, did you flag any that I maybe missed and didn't ask? I'm just looking here really quickly.
You do have one hand raised. I don't know if that was.
Oh, okay, let's go. Let's try it.
Noah, and another hand too.
Okay, Renoa, we're gonna put you on live. Let's get you in. Okay, I'm just activating your audio. Renoa, you're on live. You can go ahead and ask your question if you still have it, Renoa. I could be mispronouncing it. Hreona maybe? Hreona Bays. You're on live. You can unmute yourself if you do have a question. While Hreona or Riona holds on to their question. Deborah, I saw that you raised your hand quickly. Deborah, let's see. Just gonna unmute folks here really quickly and see if they want to ask some questions live in air. And apologies for the delay. This is like a radio switchboard. We're just trying to find people and then unmute them. Okay, so Deborah, I know that you raised your hand briefly. You are unmuted. Okay, you're on live if you want to ask a question. Deborah, the airways are clear for you. You just have to unmute yourself. Does anyone hear anything? I don't. No. Okay. Deborah, it's the audio's on your end. You are unmuted. We can see that you're unmuted, and your audio feed is active right now. There's probably happening something on your end. We'll just hold off. I'll leave you unmuted until you can figure out your audio. Riona, your audio also is unmuted. You just have to unmute yourself in order to ask your question. Let's go to a third question here. This is from 203-645-3952. You're listed here as asking a question, 203-645-3952. Okay, so those three people do have their audio active, so at any point, if they unmute themselves, they can go ahead and just talk, and we're here live. In the meantime, we're gonna just take the last two questions and then move on to the OEC audit. Okay, Barb Davis, in the meantime, do we keep following the outdated EpiPen regulations? Also, speaking of regulations, does anyone know what's happening with the proposed regulations? OEC?
I'll answer the first part, and the deputy commissioner might have audio now and be able to answer the second. So yes, you need to follow the current regulations. And licensing is not my division, so I can't answer the current status question.
Okay. So thank you, Deb. We just saw that Riona's question got answered, so no worries. Thank you, Riona, for letting us know. I think that's all the questions we have for the Department of Health. Thank you to our state epidemiologist, Dr. Lynn Sosa, Kristen Sota from the Department of Health, and the Department of Health team. You are getting so many comments here in the chat for just thanking you for helpful and new information. So it seems that a lot of the providers on the call, a good, like more than 90% of our participants on this call are active educators. They run a business or they're in the classroom. So this is very helpful on the day-to-day and figuring out how they manage staff when this flu season hits and it's coming strong. And what is it, boo? What's your saying?
Flu before boo.
So there you go. You got it from Kristen. Flu before boo. So you guys have a couple of weeks, couple of days before the big Halloween for those who celebrate and have fun in that trick-or-treating. But the important thing, regardless of your celebration of Halloween or not, is get a shot, be active, and make sure that you stay safe. Thank you, guys. We're going to move into OEC and the audit conversation. So I'll pass it back to OEC, Elena, our Deputy Commissioner, if you want to take it away. Ms. Truthworthy.
Great, thank you so much. First of all, I want to give a big thank you to the Department of Public Health for their ongoing partnership throughout the pandemic and even so today, and will continue on. For Governor Lamont, it's really important that state agencies work very closely together, that we have strong partnerships, that we collaborate to share the expertise, to share the knowledge content. And what we just experienced with that conversation and that Q&A is such a good example of how these partnerships are really fruitful for everyone. And I'd like to thank Deb Fliss as our lead for the agency around emergencies, around incident command as well. And so we're going to jump into another partnership that we have with a sister state agency, the Connecticut State Department of Education. And Justin, I'm going to hand it over to you. Thank you to the Early Care Connection because for inviting us on to be able to answer some questions. Information has gone out to the field, which raised some questions. Clarifying letters also went out in English and Spanish most recently that Justin will review. And so really wanted to have this opportunity to clarify the information that went out and to also answer any questions. So thank you. And Justin, over to you.
Good morning, everyone. Thank you for having me today. My name is Justin Cleary. I work for the Connecticut State Department of Education's Office of Internal Audit. And today, as Elena said, we'd like to talk about the single audit requirements for child care programs who receive grant funding from the Office of Early Childhood. Before we start, I'd like to just give a little bit of background. Our office, as Elena acknowledged, we provide internal audit services for both the Connecticut State Department of Education as well as the Office of Early Childhood. And one of our major functions is to notify all grantees for both agencies of their audit requirements, which are mandated by federal and state law. Additionally, each year we publish instructions to assist grantees who may be required to have them. So for this year, on August 3rd, we had sent out a letter to OEC grantees to notify them of their requirements for audit. After this letter was sent, we determined that many of the child care providers who received the letter were not actually subject to these requirements because of their business type. So I know that created some confusion, and hopefully we can clarify that today. On last Thursday, October 12th, we did send out a clarifying letter, which hopefully clarifies the types of organizations who are required to have these audits, or at least are subject to the requirements. And that brings me to my presentation for today. So I'm just going to share my screen quickly. Can everybody see these slides?
Justin, we can see your screen. If you could just lay it out larger, that'd be helpful.
Sure.
Go to slideshow.
All right, I'm not used to presenting with Zoom.
Yeah.
You just got to click on slideshow right there.
Okay.
From the beginning. Yep.
Is that better?
It's better. It's what do folks think? Is that okay?
Is there something on Zoom that I need to change?
There's a thing that says agenda. What's a single audit? Looks like notes, maybe. I don't know.
Yeah, if you're on multiple screens, Justin, I think it's your other screen for because
Yeah,
we're seeing
I just have one screen.
Okay.
It's the way that you're showing it. So I think you did presenter view, but with your notes, so you can see the slide deck with the next slide deck as a preview. So there should be a setting that allows you to see each slide as it goes rather than a preview of the next slide.
Might be display settings up at the top. Maybe not.
Yes. I think that one, right?
Yeah. Oh, there you go.
Perfect.
Awesome. Justin, we can see it clearly.
Nice job.
Thank you.
Good teamwork. The floor is yours, Justin. Go ahead.
All right. We've done the introduction. So as I said, we sent out a clarification letter. And today we're going to talk about, hopefully clarify these items here. What is a single audit? Who do the single audit requirements apply to? Are you required to have a single audit? What if your expenditures are less than the audit thresholds, which I'll define in a little bit? What do I do if an audit is required? And then we'll talk about due dates and then other potential reviews that may be required. So what is a single audit? A single audit is an audit of an organization's financial statements and its federal and or state grant programs, such as school readiness or CDC grants. These audits are audits that are required by law for entities that receive state or federal grant funding. So it doesn't matter what grant specifically, if you receive the funding, you may be subject to these audits. And it's called a single audit because it's one audit that would include all of your state and or federal grant programs. And the audit, it would just be one audit that would cover everything. As I said, these audits are required by law for organizations that receive federal and or state financial assistance. And they have to spend over a certain dollar amount, which we call an audit threshold. And if they do, then an audit would be required. So who do the audit requirements apply to? And I think this is where we had some confusion with our first letter that went out. These audits apply to municipalities, so your towns and cities, not-for-profit organizations, and school readiness grantees. And these school readiness grantees also include for-profit agencies that receive $300,000 or more of state financial assistance and spend over the 300,000 or equal to or over the 300,000. I think where the confusion came in is a lot of for-profit organizations received our letter. For-profit organizations are not by law subject to these requirements unless it is made a condition of receiving their grant, as it is with the school readiness grant. So for-profit organizations that received our letter, they aren't required to do an audit. They are not even required to file an exemption form because the law does not cover for-profit agencies. So I hope that part, I believe, was what was causing a lot of confusion. So for those entities that are subject to the audit requirements, again, which would be your towns and cities and your not-for-profit agencies, and your school readiness grantees, you would be required to do an audit if you received and expended over $300,000 in state grant assistance during your fiscal year. On the federal side, you would be required to have a federal single audit if you've received and expended over $750,000 in federal grant funding during your fiscal year. And so when you're trying to determine if you met those thresholds, it's important to remember that this includes all of your grant expenditures from all sources. So if you received 3 different state grants, it's the total of your expenditures of all 3 grants, which goes into calculating whether you've met the audit threshold.
So Justin, just to clarify, the stabilization grants that programs got were federal funds. So the threshold, if they would be 750,000 for federal funds?
I believe most of the stabilization grants were federal. There's some grants, I believe, that may have been under state coding. So that if you have questions regarding whether your grant funding is federal or state, I would suggest contacting your program manager to clarify that specifically. So if your expenditures are less than the audit threshold, then you are exempt from doing an audit, but an exemption form must be submitted to our office. So if you receive state grant funding and you haven't spent over $300,000, there's a state single audit exemption notification form that would need to be sent to us. It includes some basic information, and it can be filed at the email address that's listed here. I'm actually going to post this presentation into the chat afterwards because there's a number of links here that would be helpful for those people who are subject to the requirements. And one thing to remember, if you don't receive a state grant, then you don't need to file a state exemption form. So you may be in a situation where you receive a federal grant and you don't reach the threshold, so you need to file the federal exemption form. However, you may not receive any state grant funding, so therefore you don't need to file a state exemption form. Or it could be that you receive both federal and state grant funds, but don't meet the thresholds and need to file both forms. So what do you do if an audit is required? As I mentioned earlier, our office, we publish audit instructions, which go over a little bit of what I've talked about today with regards to who the audit requirements apply to and how to determine whether you've met the audit thresholds. But it also includes additional information specific to the types of schedules that will need to be prepared for audit. It also includes specific grant accounting information that is useful to your auditor who will complete these audits if you're required to have one. So if you are required to do an audit, I recommend visiting our website through this link here and looking at these audit instructions and definitely providing your auditor with a copy of the instructions as well. They will probably guide you through the process if you need to have an audit. So if you have additional specific questions regarding audit, my contact information is here. My colleague, Tom Markowski, he's also available if I can't be reached. And then for specific questions regarding your grants, Julie here has provided her information. And I'm sure if she can't answer the question, she can definitely direct you to someone at OEC who could answer more grant specific questions. And so due dates. State single audits are due 6 months after the end of your entity's fiscal year. So your fiscal year is basically that 1 year period for which your organization does its financial reporting. I know like the state is on a July 1st through June 30th fiscal year, but your organization may be different. Some organizations operate on a calendar fiscal year. So it would be for state single audits that are required, it would be due 6 months after the end of that fiscal year. Federal single audits, it's the same thing, but it's 9 months. And the exemption forms must be submitted to our office within 6 months of the end of your fiscal year for both federal and state, if they're required. And then one note is that the exemption forms, they have to be sent to us after the end of your fiscal year. We can't accept them during the middle of your fiscal year because it's based on the amount of grant funding that you've received and expended during the fiscal year. So we would obviously need that information at the end.
Justin, can I just clarify? It is just this current fiscal year that this letter applies to in this requirement. Is that correct?
Yes, that's correct. So we send these letters out annually. Next year, I think we have a better process in place where the grantees who the letter applies to will be sent to them, and hopefully there won't be as much confusion like there was this year. And so lastly, the information that I provided today was specific to the federal and state single audits that are required by law. However, this does not supersede any types of program reviews, monitoring visits, or any other monitoring protocols that may be required as a condition of your grants. If there is something like this, it would be listed in the terms of your grant. And it also does not supersede the ability for the federal or state agencies who have provided you those grants from conducting any kind of special audit or review that they deem necessary. So that's pretty much the end of my presentation. I hope this helps to clarify the requirements. But if you have any specific questions, please ask away, or if you'd like to email me again, I'll post this presentation with the contact information into the chat.
So Justin, we have a bunch of questions here. So Colleen, yeah, go ahead.
Maybe Justin, it would be helpful to go back to the slide around who is eligible and who is, who is subject and who is not. I think that is an important piece. Yeah, thank you. Sorry, Merrick, go ahead.
So some of them are simple things like the exemption form asks for a CEO signature. What if we don't have one?
Okay. So the exemption forms, these are very standard forms. They're pretty old. Basically, if you are the highest ranking official in your organization, you can sign as the CEO and the CFO. Those forms come directly to us. So as long as we know that it's coming from the highest ranking person at that organization, then we can accept that.
Okay.
Before you go into the next question, I just have to make a reminder here in housekeeping. Please, everyone, we ask you to put your questions in the Q&A. I see folks putting questions into the chat. If you put it into the chat, because we open the chat for anyone to respond and to chime in, we might lose your question and might not ask it, especially in the time that's committed. Like we try to go in time order. So please just make a point to use the Q&A and then leave the chat for information or comments that we're sharing or you want to share with other ones. Thank you. Go ahead, Justin.
Okay, so there were a couple of questions. One was about, is Care for Kids included in these totals?
Yes, Care for Kids is considered state financial assistance.
So if you're a program that just is getting Care for Kids, you'd have to meet the $300,000 threshold before you would.
If Care for Kids is the only grant that you received and you received and spent over $300,000 or more, then a state single audit would require it.
Okay, I didn't realize that. I thought Care for Kids was a supplement, a child care subsidy that goes through families as opposed to like a contract like CDC or school readiness.
So yeah. I believe the audit would be of the provider.
Audit of the provider. Okay, so if you get more than $300,000 in school readiness funds, you have to have an audit if you're a nonprofit, but not a for-profit.
School readiness funds, that would include for-profit.
Right, but for Care for Kids, if you just got Care for Kids and not any of the other things.
I'm sorry, I'm not sure if I understand.
So Care for Kids is the child care subsidy payment that parents get to pay for their child care. It's paid out to providers through 211. Is that considered a grant like school ready, like a stabilization grant or a wage support grant? Or you're saying
yes, it is.
Okay, all right. So if you get school readiness and Care for Kids and the total combined to more than $300,000, then you need to have an audit.
You broke up, Justin.
I said correct.
Correct.
That would be true.
So there is definitely a question here about, we got a bunch of different pots of money that came out in the past year. Is it possible for someone to state what was state funding and what was federal funding? Were the wage support grants state funding and the stabilization grants federal? Am I understanding that correctly?
Yes, that is correct. Yes.
Okay.
I think what's really important here is to really understand if you as a program, are you subject to these audit requirements that we're talking about today? Because we're anticipating for the vast majority, you are not, right? If you are a for-profit organization and you do not receive school readiness funding, you're not subject to these requirements. And so I think that's the very first really important question to answer for yourself as a program. Those who are school readiness grantees, right, are CDC grantees, like for the most part are used to this process of auditing and whatnot. And so, but because the letters went out to so many programs and individuals, there are now a lot more questions, which is great so that we can clarify them. And I think for the most part, we'll take the majority of these questions and make sure that they're correct, and we'll share those answers back with the Early Care Connection team to be able to share out to everybody.
Elena, I just to continue that clarification, if you are a home-based provider, a family child care-based provider that sustains your child care with Care for Kids payments and only Care for Kids payments, if you are maxed at 9 kids, full house, you do not qualify to have to do this audit because you are receiving less than $300,000.
Well, you're exempt because you're a for-profit entity.
As well, correct. So if you're a home-based provider on Care for Kids, you do not have to worry about these audit requirements.
So here's a question that says, if our school readiness funds are under 300,000, but with the wage supports and Care for Kids, it puts us over 300K, do I need an audit?
Yes. If you're receiving school readiness grant funds, and even if you are a for-profit entity, if the readiness funds are not equal to or over 300, but you have another state grant that puts you over the threshold, then yes, you would be required to have it.
And then someone asked, what would happen if we don't think we have to file an audit based on your information shared with us today, but we actually do have to file one?
So our office, we track the grantees that we would expect an audit from. So we would just contact the grantee and let them know that they are required to do an audit. And then if it was getting kind of late with regards to the deadline, there are processes for getting an extension. Obviously, given the communication that has gone out, we would try to be lenient with the extension process because obviously there has been some confusion over this. But hopefully, it seems like a majority of the people who received this, the letter, fall into the for-profit group. So I think the majority of them will just not be subject to these requirements.
There's a question here asking, do you have to meet both bullet points right here on the screen, or just one of the bullet points in order to apply for the audit or to do the audit?
You have to do the audit. So it's only one of the bullet points. There's basically, while it's called a single audit, there could be 2 components. There could be a state component and a federal component. And so if you meet one of the thresholds, then you will have to do that component. So if you met the $300,000 threshold, you would have the state single audit component within the audit. If you met both of them, then you could have both your federal grants and your state grants tested within the audit.
Eileen Costello wants to know, why are for-profits exempt? What about public schools as well? So that's a 2-pronged question. So first question, why are for-profits exempt? And her second question, what about the public schools?
So public schools would fall under the towns and municipalities. So public school districts are audited under their towns. So they are not exempt from audit, or they are subject to the audit requirements, I should say. For-profit entities, the law does not address for-profit entities. The State Single Audit Act and the federal audit guidelines under federal uniform guidance do not address for-profit entities. So the law just does not apply to them.
Okay, thank you. We have here, again, another point of clarity. Someone wants to know if you take care for kids, do you have to be audited? Just for those of you who are family childcare on care for kids, you do not have to do an audit. If you are a center with family childcare and you have other sources of revenue, then please read these requirements very carefully before you make that decision of not doing the audit. Do I have that correct, OEC team here?
Yes.
Right, right. And I think just for care for kids specifically as well, and for these, we're going to take all these questions and make sure that we answer them, because, you know, care for kids, for example, has multiple funding streams, state, federal, and others. And so we want to make sure that we're sharing the correct information on all of these funding streams.
Okay. We've got another question. If possible, this is from Joyce. If possible, can someone state the kinds of funding programs that you did receive in the grant periods of July 1st, 2022 through June 30th, 2023? Wage support labeled grants were given during this time frame, but wasn't stabilization labeled funding given in 21-22?
Right. We've had 3 rounds of stabilization funding that has gone out in different years as well. And so I think that was part of the reason why I made sure that we're just talking about this latest fiscal year for programs, because it will only include the funding for this last fiscal year. And so we can lay out all the different funding streams that have gone out this last fiscal year.
Okay, thank you. Anonymous wants to know, does WBDC money also, is that also included in the audit requirements?
Sure. You say WBBDC.
So Justin, the woman, so OEC, in addition to stabilization monies that were given, also gave money to organizations, other nonprofit organizations like the Women's Business Development Center, to then divvy out state money to providers through the Women's Business Development Center. So I guess the question here is, does it matter where the sources come from if they did receive and applied and accepted that money?
Mm-hmm. I think, again, we will get what funding sources are to be included in this and share that out.
Okay. I asked the OEC team, we have 23 questions that are open right now, and I don't want to miss the opportunity to try to answer most of them here in live time. So if there are OEC team members that can go into the Q&A and type in some answers to just get some, filter out some of these easier questions or repeating questions, that would be very, very helpful.
Mm-hmm.
Okay. Just sifting through here. Let's see. If we didn't spend all of our stabilization money by the end of September, do we have to send it back?
So that's for, Justin, don't worry about that.
Sorry about that. I read, and it's not quite connected to today's topic, but it's out there. I already read it. If you have an answer, that'd be helpful.
Right. So we asked that communication happen with the CCDF team. So you have Julie Giaconi's contact information there to contact the CCDF team with those specific scenarios, specifically about stabilization.
Daryl, do you see any question that we should ask right now? I'm just sifting through.
Let's see here. So someone's
I see
saying,
that.
yeah, someone's asking, do we need two audits, one for state and one for federal?
So if you met both thresholds for state and federal, you could potentially have both of those components in your audit. It wouldn't be two separate audits. Generally, you would hire a CPA firm and they would perform both components, the federal component and the state component, all at one time. So you would not have multiple auditors doing different audits. It would be one auditor who would conduct both components.
Okay.
Rhonda wants to know, I don't quite know what this means, but hopefully you guys know. Can you talk about the open checkbook on your website? And she says that it would be helpful if you mention what the check, or sorry, can you talk about the open checkbook website? And yeah, I'm hopefully that means something to you guys. Checkbook website.
Sure. Open Checkbook, I believe it's a state website that utilizes the state accounting system, and you can search by year any payments that have gone out to certain organizations. So it's as simple as you could type in the name of your organization and select that fiscal year, pick last year or the year before, and it would show any kind of payments that have come from the state to the organization that you're searching. And it provides information as far as the date that those payments were made.
Thank you for that. And thank you, Rhonda. Always on the up and up, super knowledgeable about what's happening and what providers need access to. Bernadette wants to know, again, there's just so many questions here about clarification of stabilization money versus care for kids money. So many similar questions. Let me go to oh my goodness, there's so many questions. Sorry, bear with me, guys. You have a lot of very similar questions. Jessica says, if you're a program that has CDC, school readiness, and received care for kids, and each program is over 300,000 cap, does that mean we have to do a single point audit for each program?
So you would have one single audit, and what would happen would be that the auditor would look at potentially all of those programs. This is going to get kind of technical when I explain this, but the auditor, he looks at all of the programs on a schedule. He looks at the amounts. He performs risk analysis, and depending on the size of those grants, he may test all of them. He may only test one of them or two of them, depending on the results of his risk analysis with regard to those programs. However, the requirement is that you've met the threshold and that you have a state single audit. So the auditor will determining what programs to be tested won't affect any kind of compliance on the programs side or the provider side. Once they have the audit, then they're in compliance. They just, with the audit requirement, they just would then rely on their auditor to do a risk assessment and test the programs he deems worthy to be tested, and then we would accept that.
Okay. Eileen Ward wants to know, we are under her childcare space is under $300,000 threshold. They submitted the extension form, but did not include Care for Kids funding. Will they still be under, and they're expects to still be under the threshold? Should she resubmit and a revised exemption form to include the wage support grants and Care for Kids?
Yes, please.
Yes. Okay. There you go. Directly from the source, Eileen. Judy Keeney. You know what, Judy? I'm going to hold off your question because it is slightly off topic. Let me just sift through some more questions here. Justin, is there more to your presentation, more visual slides before I keep going?
No, we had completed all the slides that I had.
Okay, okay. Just wanted to make sure. Um, Here's anonymous. What would happen if we don't file an audit based on the information you shared with us today, but actually have to do one?
We would, I mean, we track who we expect to receive an audit from, so we would contact the organization and find out whether an audit is in process or if it's going to be conducted. And then if someone was to not want to comply with the audit requirements, then we would basically provide that information to the Office of Early Childhood, who would have to make a decision on whether to continue to fund that program based on their noncompliance.
So there's a question that says, I'm a nonprofit center and I'm definitely under the thresholds, but I have no idea which funds came from where, like what was state money, what was federal money. We need a list of supports that were given within the time frame so that we can accurately complete the exemptions.
Again, I think that's something that we could work with OEC to provide. Yeah. In the meantime, again, I would recommend if they contact their program manager, they could get that information as
well. Georgia wants to know if you're an FCC receiving CDC funds, would you then qualify to do an audit?
I'm sorry, what's a FCC?
Family child care provider.
Okay. And can you restate the question? I'm sorry.
So I guess the point of clarity here, Justin, is that in the world of childcare, there's different types of providers. There's centers who might be listed as a nonprofit. There's centers who are for-profit, but there's also childcare providers who perform the childcare duties and are licensed in their home. The vast majority of those home-based providers have no nonprofit affiliation. They're for-profit entities, but some of them do receive state funding, a myriad of state funding. So the question here from Georgia is, if you're a family child care provider and you're receiving CDC funding, then do you qualify? Do you have to do an audit even though you're a for-profit business?
No, for-profit, again, they are not subject to the laws that require these audits, with the exception right now of school readiness grantees, because that is a requirement that's included in the school readiness contracts and per OEC policy.
Okay, so just interpret this, and Elena and folks, just correct me if I'm wrong. So my interpretation of this, if you're a family child care provider, and by, if as long as you, for whatever reason, if there's any chance at all that you filed as a nonprofit, as a family child care provider, and by any chance you surpass $300,000, then you would have to do an audit, right?
Correct.
I don't know if these individuals exist, but I'm assuming if they do, it's very rare.
Exactly. That's why we started off with, for the vast majority of providers on this call, these audit requirements specifically will not pertain to you. However, we did want to just raise this up, right? Audits are an important part of, running a business and being aware of different audit requirements as well. And we're also in a very different situation, right? Where we have received, as a state, and providers have received a lot more funding through federal and state channels than we have in the past because of COVID dollars that have come down, et cetera. And with family child care providers now being part of our state system, right, through child daycare contracts, this is a little bit of a brand new world as well. And so, contracts have language in them about audits as well. So to pay attention to that if you are a contractor with the Office of Early Childhood. And our program managers are very knowledgeable about what's in contracts and also what is required as well. So,
okay. If the center funds are under 300,000, but with wage supports and ARPA funds and Care for Kids, it puts us over 300, do we need to do an audit?
Yes, it sounded like there was some of the funds that you listed that may have been federal. So again, it would be important to determine which grant funding you received as state and which grant funding you received as federal, because the thresholds need to be calculated separately based on the type of funding.
If the stabilization funding was that they receive is over a couple of years, what audits do they need to send out? The most recent fiscal year?
Yeah, so today what we're dealing with is this fiscal year that has just ended or may just be ending. Again, this is all based on the organization's fiscal year, how much they've spent within their fiscal year. So an organization may have a fiscal year that starts January 1st and ends December 31st. Or it may be similar to the state where it starts July 1st and ends June 30th. So the way that it would be calculated would be by their fiscal year. How much have they spent in that 1 year period, and did they meet the thresholds?
If someone does exceed the 300,000 and they have to do an audit, is there any support to help them do an audit? They want to know how much does an audit usually cost, and is there any support to pay for someone to help them do an audit?
So as far as financial support, I don't know the specifics of all of OEC's grants. I know with education, there's sometimes they allow portions of the audit to be charged to a grant, but with OEC's grants, I'm not that familiar with them. As far as support on how to do an audit, that's where our audit instruction document comes into play, which is linked in this presentation. And it was linked in the letter that we sent out on Thursday. The link brings you to our website where those instructions are listed both in English and in Spanish. And again, after going through those, if there are any questions, my contact information is there, so I could help someone individually if they needed help going through the audit process.
Nicole wants just one more clarification here. Her center receives $750,000 in federal funds and $300,000 in state funds. Does she have to do an audit?
Yes.
Yes. If she's assuming she's a not-for-profit organization.
Okay. Nicole, as long as you're a not-for-profit, then yes. Okay, so I do have can folks stay on for about one more minute because I have like 4 more questions. We're at the very, very end here. Okay. And then I want to give some airway time for Karen. I'm a nonprofit center and I'm definitely under the threshold, but I have no idea which funds came and from where they came. We need a list of supports given within the time frame and where they came from in order to accurately complete the exemption. So that's just an important comment. Heads up to the folks on the state. Please, I know that you mentioned that you're going to get a list, but it seems that it'd be very helpful for a lot of people to clarify if they have to do it or not. And sorry, Sandra, I was going pretty fast. So again, we do hope for anyone on the call wondering to get a list out as soon as the state has it of who qualifies and who doesn't qualify for those different types of payments. And thank you, Julie, for putting the information on there. I'm going to do one more last question. Is there a way to enter their organization's information to the ct.gov website to determine if they have to file an audit? If there's someone who they can contact and share their information to try to tell them if they can file an audit. So I guess to wrap it up, Justin, contact information where people should go to, and if there's anywhere to guide them.
Again, so my contact information, I can be a resource to help them with that. And then once we can work with OEC to get a definitive listing of the grants and what types of funding they are. So I can be contacted. My contact information is listed in this presentation. Again, I'll post this into the chat for people to access. And if there's another place that you would prefer to post, I don't know if you have a website, I can email the presentation to you so that it might be more available to people.
Yeah, please do that.
But yes, I can work with individuals if need be to help them determine whether or not it is needed.
Okay. Justin, Deputy Commissioner Trueworthy, OEC team. I know, Julie, thank you so much for all of this information. Very helpful. I know that providers are going to be on the lookout in the next few days for those links, additional links or details that you promised. For any reason, providers on the call did not get to your question, apologies. We did go through over 50 questions. I know this was a little dense, and thank you for your patience while we went through it. Before you all leave, I just wanted to remind folks that the CTAEYC Kayak has their annual conference happening this October 27th through 28th at Tungus Community College. This is the last week to sign up to participate. They do need a head count because, food, etc., chairs, and make sure to plan for this awesome conference. They have one every year. The conference that's hosted is informational, definitely directed to all of you on the call, provider information, provider training resources. So, come and join us, attend the conference. We're going to put the link on the website for the kayak event. And don't forget to share with your peers so that they can also participate. The invitation's open to anyone at all. So share far and wide in the provider arena. Thank you again to our translator, Sandra, who always does a phenomenal job. And it's not easy when we give her some dense material. And once again, for the Department of Health, updating us on what's happening in all things COVID and flu season. Remember, flu before boo. So we have a few more days to get those flu shots and COVID shots up to date. Once more, OEC, Justin, Elena, thank you so much for the support, and we'll see everyone very soon. Take care and have a wonderful rest of your day.
Thank you.